This is an ankle tape job for an inversion ankle sprain, non-acute. Inversion ankle sprain happen when the foot goes down and in this direction, usually damaging the anterior talofibular ligament and the calcaneofibular ligament. So what we want to do is we want to protect those ligaments and block the movement into inversion. You start off with the person lying on their back on the bed, enough leg coming down where the calf actually joins the tendon, so where it narrows is as high as you want to tape. You maintain the foot position into a 90-degree position with the opposite knee tucked up to his chest. Starting off with a light spray of skin toughener. This helps with the adherence of the tape and helps protect the skin. You apply heel and lace pads to prevent blistering over top of the tendons on the front and the back of the ankle. You apply Pro Wrap, making sure that you leave enough skin to actually attach the tape on. You put a light stretch through the Pro Wrap. This is meant to protect the foot from multiple applications of tape. Then you apply 2 anchors above, making sure that you angle the tape, respecting the shape of the leg. Apply 2 anchors in the foot, making sure that you apply almost no pressure, just a light stretch of the tape. You would then apply 3 stirrups, working from the medial side to the lateral side, making sure that you do not put the stirrup in through just behind the 5th metatarsal. A common mistake is to drive tape right through this point, which will actually cause quite a bit of pain. For the purpose of the demonstration, we're using different colored tape. As you bring the tape up, you get the person to pull the foot up and out, and maintain that position. What you want to be able to do is fan your tape strips so they don't go run right on top of each other, but they fan along the outside of the ankle itself. Maintaining that position, you would then apply a lock. You start on the inside, go behind the ankle and across the Achilles, and pulling back up the lateral side. Pull the foot up and out, and apply the tape. You want to apply 2 of these locks. Again, fanning slightly. Up and out. You would then apply one on the opposite side. Help stabilize the medial side. You don't pull up hard on that one, you're just putting it in place to help protect the inside. After that, you apply a figure 8. Coming up across the front of the joint, around the back, forming an X across the front of the joint. Up and out. Apply a second figure 8. And now you begin to close. You could basket weave. My suggestion is just to basket weave and fill in your spaces. Make sure you leave no windows, no open spaces, and then close from the top, working from the outside around the back to the inside, making sure that you close all windows and you cover all shadows. It's important to try and minimize the number of wrinkles you have, especially over weight-bearing surfaces. In other words, the bottom of the foot is much more important than having wrinkles or worrying about wrinkles on the top of the foot, but any place where there's going to be repetitive rubbing or movement. You want to go back up to where you started and then put one more to close off at the bottom in order to make sure that the tape doesn't roll when they put their sock on. Use the back of the tape to help put pressure down and to actually close down all the tape against the skin. You then want to check their sensation and make sure that they have full sensation and they have cap refill, meaning that when you squeeze, you can see the blood coming back in, either on the nail bed, as you can see here, or on the skin itself. You'll see the blood coming right back in. And you want to make sure you check that on all tape jobs. Then what you want to do is you want to recreate the stress of turning the foot down and in. And you can see he's significantly limited, and the tape is holding him in position there nicely. At this point, that's not the decision to return to play. You want to take him out and you want to make him do drills that are specific to his sport to test to make sure that he is capable of playing at 100% with no pain.